Ever tried fixing something yourself and made it worse? I've done this. Why hire a pro? They're expensive. I'm smart. I've got a physio degree and AI knows everything, right? Not so sure. Once I thought a coat hanger would fix a clogged toilet. Instead, the coat hanger got stuck and the plumber who came to fix it wasn't too pleased with me. Or that time I tried to fix the kitchen sink and flooded the room below. What a mess. Another plumber told me just to leave it to the experts. Recently, when I had an electrical issue, I skipped the do-it-yourself tutorials and I called a real electrician. You know what? No sparks, no fire, and the lights work perfectly. My wife is so happy with me. Electricity seems so simple, but it also causes a lot of house fires. Do-it-yourself physio and artificial intelligence can lead to ineffective and harmful treatments due to a lack of personal involvement and insights that experts bring. As a physio, I regularly meet people who just want to do it themselves. Therapy's too expensive or they have no insurance. But you need to understand the risks of do-it-yourself approaches, the value of your expert physio opinion, and how to approach these patients who say they just want to use AI. The three big reasons why relying on Google or ChatGPT can't just replace the expertise of a real-life therapist are Google and AI can't be in the room with you. Google and AI can't give you psychological support and motivation. Google and AI can't navigate the healthcare or debunk pseudo-scientific science for you. And stick around to the end because I've got a bonus that just might surprise you. Now let's get going with our first reason. You might think that Google's pretty smart, but can it give you a massage? I don't think so. Section 1. Google and ChatGPT can't be in the room with you. I have two examples here. First, Beat AI with Hands-On Physio. There's no app that can replace you actually looking at your patient. You see how they walk in. You see their range of motion, their facial expressions. There are so many non-verbal clues in a physical exam. I'd love to see Google interpret the scapulo-thoracic rhythm of a patient with shoulder pain. And with active exercise treatment, real-time feedback during the exercise helps correct bad habits instantly. There's no substitute for a real-life coach. Even a simple bicep curl can go all wrong. If he's leaning back, if he's leaning forward, AI is good, but it's not that good. So you can watch a ton of YouTube videos and practice at home, but sometimes you just need somebody else to watch and tell you what you're doing wrong. Second, craft individual treatment plans for each patient. As physios, we don't just look at the patient, you look at everything around them. You look at the clues and connections and patterns. That's what we do as therapists. We don't just look at their pain, we look at the whole body and see how it's connected and how you're moving. We're like detectives, but instead of solving crimes, we're solving for function. And every patient is different, just like everyone has their favorite flavor of ice cream. Everyone has their own unique needs. My physio approach emphasizes simplifying the diagnosis and treatment by categorizing patients into certain diagnosis and treatment categories. This makes them manageable. The decision making and communication become easier. I go into more detail in this video up here. So we've established that Google can't give you a proper exam, but you know what it can't give you is also a good pep talk. Section 2. Google and ChatGPT can't give you psychological support and motivation. I have two examples here. First, the mental side of coaching. Think of recovery like a roller coaster. There's ups and there's downs, and sometimes you feel like you're in a scary loop. But don't worry, physios are here to keep you safe. We've all had patients who are scared. That's what we tackle together. And by the end, we're throwing our hands up and having a blast. This is the difference between being on a roller coaster and watching one on YouTube. Practically speaking, I like the motivational interviewing approach. Watch this video here. There are tons of other videos on YouTube. Your physio interview is a much better way to communicate than just typing in the Google search box. Second, partner with a pro. We've all had patients who find it tough to stick to their home program. That's why part of our regular visits is accountability. Sure, we can advance or tweak their exercises, but a big part is just helping them getting into a routine. I found that the simple act of knowing that they have an upcoming appointment can really motivate patients to stay on track. It's amazing to see how this accountability helps them reach their goals. It's not always easy, but that's where physio support comes in. And we don't just throw exercises at people and hope for the best. We're like detectives trying to figure out what makes each patient tick. It's a puzzle to figure out their medical history, their family situation, their functional loss, and then their own personal goals. And don't forget, patients are human. They have moods, good days and bad days. Faster than a cheetah on roller skates. You got to just roll with them. So we've talked about the body, we've talked about the mind getting in shape. Now we have to make sure that the treatment plan isn't full of baloney. Section 3. Google and ChatGPT can't navigate the healthcare or debunk pseudo-science for you. I have two examples here. First, navigating the healthcare system and balancing science and pseudoscience. AI can't help you navigate the healthcare system. Remember those Avenger superhero movies? Healthcare is like all those superheroes, each with their own special powers. As the physio, I could be like Iron Man. That'd be cool. But not Hawkeye. He's not my favorite. So in every mission, you choose the superhero with the powers that they need. As the physio, sometimes we see a patient and that patient has needs. So we say maybe the patient needs to go to a massage therapist or have a family doctor visit. Those are two very different referrals. Just like I wouldn't send Hulk on a stealth mission, I'd send Black Widow. Of course, right? It's obvious. Physios are the heroes that help the patients navigate the healthcare system. Google just tells you what's nearby. This may be controversial, but balancing science and pseudoscience in physiotherapy. You know, when it comes to physio treatments, we like to think that we're all backed by solid science. We make it a point to use the best evidence that we have to steer clear of anything questionable. A good physio will definitely keep you away from unproven methods like kinesiotaping or acupuncture. I told you it was going to be controversial. Instead, they tend to focus on treatments that are actually effective and grounded in research. Yes, I have to concede that this is a weak argument. Many physios love their passive, feel-good treatments. There was a recent video on craniosacral therapy. I know some physiotherapists love this, but there's no good evidence and it's a placebo benefit. This is why I keep advocating for active exercises and solid patient education. We can make a real difference, a lasting difference, but it's based in reality. Congratulations for getting this far. You've earned the bonus section. Bonus section here is AI can't spot red flags and when do-it-yourself fails. First, when to swap AI for a pro. Sometimes do-it-yourself is fine. It's like fitness. Not everyone goes to a gym. Not everyone has a personal trainer. But you need to be honest with yourself if you're not getting the results that you want. Some of the objections I raise, like having somebody watch you or critique your exercise technique, can easily be done by a personal trainer. I've worked with some great trainers. But they need to know when somebody has persistent soreness or a nagging problem that they might need more skilled eyes. Ideally, we'd have trainers sending patients to physio for a consult, just like we'd have physios sending patients to personal training when they're discharged from the clinic when that's appropriate. I don't know how much that really happens. And there's all the people at home asking Dr. Google for advice. If it's a low risk, low skill situation, then great, do it yourself. But there's a gray area. Some people run to the doctor for everything and won't go when and other people won't go to the doctor when they're in terrible shape. I've seen some orthos who don't immediately send all their knee scopes or post-op patients to physiotherapy, letting them use crutches or struggle on their own before referring. I'm not advocating for this, but I've definitely seen it. When do-it-yourself fails. Red flags aren't just medical jargon, they keep people alive. Physiopedia has a whole article on red flags. Go check it out. Physio is all about aches and pains and helping some guy get better at tennis. But in healthcare is really about keeping people alive. This is where a lot of physios who only work in outpatient clinics sometimes forget the whole range of medicine. The three leading causes of death are heart disease, cancer, and accidents. And active exercises can significantly improve mortality from heart disease, cancer, and accidents, especially in the elderly. So no man is an island. We all need help from experts sometimes. And the more complicated the situation, the more dire the results, the more you need options. And you're not going to get that from Google or ChatGPT. So from personalized assessments to real-time tweaks, expert knowledge and emotional support that the physio can bring, hiring a physio can complete the package that do-it-yourself doesn't offer. And AI just doesn't match up. Physios make a positive difference in patients' lives. Now, when your patient says that they'll do it themselves, you'll have a better understanding of the risks involved and the value of your expert physio opinion. How do you balance encouraging patient independence and ensuring that they recognize when they need an expert? I'd love to hear your thoughts in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, Simple Functional Exercise Progressions for Physiotherapists, to restore lifting, standing, walking. Thank you for your support. You're going to love this video, and let the subscribe button be your portal to more adventures. Thank you.